In this video, we will discuss about the LEFORT fractures. So there was a person named as a René LEFORT who was a French surgeon. So in the year 1901, he did the experimental studies on the cadaver skulls. So he used variety of forces and see the different types of the fracture occurs on the midface. So he classified into 1, 2 and 3. LEFORT 1, LEFORT 2 and LEFORT 3 as you can see in the pictures. So in this video, we will particularly talk about the LEFORT 1 type of fracture. So it is also called as also known as a subzygomatic fracture because it is below the zygoma or the zygomatic arch. So it is also called as a low level fracture and Guerin fracture. Why it is called as a Guerin fracture, we will discuss further. It is also called as a floating maxilla when it occurs bilaterally, and another name is a horizontal fracture. So this was all about the LEFORT fracture names. So before coming to the fracture line, we will discuss about the buttresses, the concept of buttress. These are basically the areas of the strength. As you can see that this is a wall and this is used to, buttress is used to support. So in the mid face, we have 3 horizontal buttress and 3 vertical buttress. Basically, this is the arrangement of the trabecular pattern. These are the areas of strength. So vertical buttress name as a zygomaticomaxillary, nasomaxillary buttress, and last one is a pterygomaxillary. And the horizontal buttresses are the supraorbital, infraorbital, and the alveolar buttress. So 3 horizontal and 3 vertical buttresses. So in the second one, you can see this is a nasomaxillary buttress and this is zygomaticomaxillary. From the anatomical structures, names are from the anatomical structures. And this is the supraorbital, infraorbital, and these are the alveolar buttresses. So these are the horizontal and these are 3 are the vertical buttresses. So coming to the fracture line, we will discuss it in the skull. So fracture line. So this is a mandible. Here we can see that this is a maxilla and this is a space called as a pyriform fossa or the pyriform apparatus. So this is anterior nasal spine. So the fracture starts above the nasal floor from the lateral wall of the pyriform fossa and it goes laterally. It goes laterally downwards. So now we know that there is a canine fossa above the canine. So this is a canine fossa. It goes laterally above the canine fossa. Then comes the zygomaticomaxillary suture. Zygomaticomaxillary buttress, and it dips down this buttress and goes posteriorly to the posterior part of maxilla, and this is a sphenoid bone. So sphenoid bone has 2 processes, medial and the lateral. So medial pterygoid plate and the lateral pterygoid plate. So when it goes posteriorly, it fractures the pterygoid plate at the junction of its lower 1/3 and the upper 2/3 of this plate. So this is all about the fracture line of the LEFORT 1 fracture. So this is also called as a low level fracture or the subzygomatic fracture. So it goes laterally. So when it occurs bilaterally, it is called as a floating maxilla because the part of the maxilla becomes mobile. So this is the part where the fracture is basically occurring. So this middle face part. So this is a sphenoid bone having the pterygoid processes. So this part where the LEFORT 1 fracture occurs. This is maxilla and these are the pterygoid plate. So coming to the theoretical part. So basically the fracture line starts from the little above the nasal floor or the anterior nasal spine at the lateral wall of the pyriform apparatus. At the lateral wall of pyriform apparatus. You can see in the skull, this is the lateral wall of pyriform apparatus, and above it goes laterally above the canine fossa. So this is canine fossa. So goes laterally and then it dips down the which buttress? Zygomaticomaxillary buttress. Zygomaticomaxillary buttress. It goes posteriorly. Then it goes posteriorly, appears on the posterior surface of the maxilla. Then it appears on the posterior surface of the maxilla. It passes posteriorly hitting the pterygoid plate or the pterygoid process of the sphenoid bone at the junction of lower 1/3 and the upper 2/3. So this was the main fracture line, and we just study the unilateral fracture line. And another fracture line, in some books there is another fracture line. They say that it starts from the medial surface of the nasal cavity and it meets the lateral line of the fracture behind the tuberosity, behind the maxillary tuberosity, and it fractures the pterygoid plate or the pterygoid process of sphenoid bone at the same point. So when this fracture line occurs bilaterally, when the LEFORT fracture occurs bilaterally, it is called as a floating maxilla, because the interior part of maxilla becomes the mobile. So it appears floating in nature. So force of this LEFORT 1 fracture occurs at the level of the above the byasis of the roots of the maxillary teeth. So coming to the clinical signs and symptoms, firstly there will be the swelling of upper lip because the force is occurring here. Second, the pain in the normal physiological processes like mastication, speaking. So there will be the ecchymosis in the buccal vestibule. There may be the epistaxis, that is the nose bleeding. It may be the bilateral fracture. Sometimes there is an anterior open bite. But why it occurs? Because there occurs a premature closure or the contact of the posterior teeth. So the anterior teeth looks like opening, so called as the anterior open bite. So it basically occurs when the LEFORT fracture occurs in the form of the telescopic or the impacted nature. That is called as a telescopic or the impacted fracture, because the dentoalveolar segment becomes stuck in the posterior part. So there is a premature closure of the posterior teeth leading to the anterior open bite. The most important and the characteristic sign of the LEFORT 1 fracture is the Guerin sign. So what is Guerin sign? It is basically, so this is a palate. So this is a type of the LEFORT 1 fracture. This is the area. So here occurs a greater palatine vessel. This is the palate, and so when there occurs the fracture, there is a rupture of the greater palatine vessel. So when there is a formation of hematoma or the ecchymosis at the junction of hard or soft palate, basically at the site of the greater palatine vessels, it is called as a Guerin sign. It occurs due to the rupture of the greater palatine vessels due to trauma. So Guerin sign is very important. So coming to the other signs and symptoms, so there occurs a cracked pot sound. So when we percuss the maxillary teeth, the normal sound is a dull. In the LEFORT 1 fracture, there occurs a cracked pot sound. So floating maxilla, when the LEFORT fracture occurs bilaterally, so it is called as a floating maxilla. There may be the other signs like the laceration will be there, ecchymosis will be there due to the trauma. So sometimes there occurs a mid-palatal split. In some cases, very rarely there occurs a mid-palatal split. So it was all about the LEFORT 1.